Hello, all. This is Dr. Dheeraj Masapu, and today we have our team of expert doctors, and who have already done their DNBs and then MD, and some are super specialists also who are in the process of training. So they actually came forward to help you guys in this counseling session in 2024. And what we're going to do is specifically we're going to actually tell you the best DNB colleges in the South Indian states, mainly Telangana, Andhra, Karnataka, Tamil Nadu, Kerala. So we will start with Telangana first. So for that, Dr. Munesh has come. So welcome, Dr. Munesh.
I'm Dr. Munesh. I have done my MD and then post MD. I have done DRNB in neuroanesthesia from Apollo Hospitals, Jubilee Hills.
Super.
So I will try to cover as much as possible of all the Telangana hospitals, and I'll start with my own hospital now. Sir, can I go ahead? Yeah. So I've been working with this hospital for 4 years now. I have done my 3 years residency in Apollo Jubilee Hills, and then I've joined here itself as associate consultant. And the first thing I would say about Apollo hospitals is that it has been there for a long period of time, and it is one of the first established hospitals in Hyderabad. So they have been running this DNB program for a quite period of time, and not only DNB, they also have super specialty courses in multiple branches. So in that way, patient load, the advancement, the technology, and all is Apollo is spearheading many hospitals, and it is very good in that aspect. And then another thing about this Apollo, if we do DNB or DRMB or gain some experience in this hospital, is that this is you get a certificate of more than 500 bedded hospital. This is a more than 500 bedded hospital. So this can help with that you can, I mean, see, if you do your course in more than 500 bedded hospital, then senior residency can be considered. Otherwise, if it is less than 500 bedded hospital, you have to do an extra 1 year of senior residency. So this is one advantage. And second thing is that this is a JCI accredited hospital. This is a JCI accredited hospital.
Oh, JCI.
Yes, sir. So JCI accreditation is very important because so with this you can get exposure in outside the country hospitals also. So JCI accreditation, just like NABH accreditation, JCI accreditation stands for Joint Commission International. So where this hospital is registered in this JCI website, and you will get foreign patients also coming in. So this is another advantage, and there is another hospital with JCI accreditation is AIG hospital.
Okay, so only two are there in Hyderabad with JCI.
As of now, what I know is two are there in Hyderabad, sir.
I think two only.
Yeah. Yes, sir. One is in this Apollo Jubilee Hills, another one is AIG. Okay. So if you are able to do your specialty in one of these hospitals, then obviously you get recognition by you can put in your CV that I have done my residency in JC accredited hospital. So that is another advantage of doing in Apollo and AIG.
Abroad, basically, you're telling going abroad would become easy. Correct, no?
Easier, sir. Yes, sir. So because the protocols which are followed in these corporate hospitals, mainly by the JCI and all, it is well recognized. That means you have gained experience where patient safety as well as your patient-centered care is very good. You are trained in those protocols. That is one of the main advantage of doing in a JCI hospital, sir. So Apollo, AIG, yes, definitely. These are two premier hospitals where you can consider this JCI being another added advantage, and you can definitely opt if you get any specialty in these hospitals. All their departments are well developed, and they have got good consultants, and all the consultants as well as the surgeries which go around or the patient load, they are all very, very good. Even I think the patient bedside rounds also are done. And not only that, they have good equipment, well advanced equipment in both the hospitals, sir. Can we go to the next hospital, sir?
Yeah. Next in the line is if you know about these hospitals, you let me know. Amrita Children's Hospital, Anand Eye Hospital, Ankura Hospital.
Yes, sir. Definitely, these hospitals are pediatric friendly hospitals. Okay. So maybe pediatricians can consider this hospital. They have got very good name in those. So I
Okay.
think they have got the neonatal care also in that hospital. So definitely it can be considered.
Okay, guys, Ankura is a good hospital. Pediatrics mainly, if you want. Ankura is okay. Then Apollo, already you told, but there are so many other Apollos also. There is one in Secunderabad,
So,
one.
I would make it very clear that only Apollo Jubilee Hills is JCI accredited.
Okay.
So rest of the other Apollos are also pretty fine, but then they are not JCI accredited. But
Understood.
then they also run multiple specialities. And yes, and there is one more good hospital I would want to speak in Hyderabad is that whenever you talk about Hyderabad, there are four competitive hospitals.
Yeah.
One is AIG, Apollo, then you have the Yashoda,
Hmm.
and you have the Care. So
Yeah.
Yashoda is another hospital where multiple branches are there, and they have also got very good caseload. And recently they have opened up one. So the earlier I think branches were in Somajiguda and Secunderabad, which
Yeah.
were good. And then now they have opened around 1400 bedded hospital in high tech city.
Yeah.
So this is considered one of the largest hospital in the country, and it is also coming up. So this hospital also you will get good exposure.
So there
And the
are
care
four branches, no? Yashoda, Secunderabad, Malakpeta, Somajiguda.
Malapati. Yes, sir. Yes, sir. Four branches are there. So all four branches, wherever you can consider, you can do it. And personally, the critical care department, anesthesia department, I think they are good. Apart from because I know about these departments, so the rest of the departments, I think also we can consider. They also run very on full flow, and they also have got very good consultants, very renowned consultants from good centers and very experienced also, sir. So
Perfect.
Care and Kims are another options.
Yeah.
Kims Secunderabad is I think the flagship hospital for Kims, and then they have also been doing very good work, and that hospital also can be considered for various other branches.
Super.
So especially in Kims Secunderabad, I think it is famous for neurosurgery. There is one specialist neurosurgeon there who does quite a number of cases. And then I think Yashoda and Kims also have name in terms of transplant. Also, good number of transplants also happen there. And these hospitals definitely they are well established. They have their own protocols, and then you get that experience of corporate. So corporate running hospitals, if you want, and you are looking forward to that where your career lies in corporate hospitals, then these hospitals should be definitely in your book that you can consider.
So what about Sunshine? Kim's Sunshine. I think Sunshine merged with Kim's. No, no.
Yes, sir. Shanshan merged with Kims, and there is one separate branch also, I guess. So I'm not quite sure, but then
But
Sunshine also has had its name. So when you talk about Sunshine, there is another hospital which starts with S, which comes to my mind is that is Star Hospital.
yeah.
And Star Hospital also, I think their cardiac services are very good. It's been known for its cardiology and cardiac services. So I think there also it's a good department.
Got it. Got
Sir.
it. Got it. So what about Care Banjara? I think even that's a famous hospital, no?
Yes, sir. Care, Kims, they all fall under same category, and then they have good corporate. This thing is so yeah. With that, any hospital in Hyderabad, you can consider. And then second thing is that with the advantage of having a DNB, doing your course in DNB hospital in Hyderabad is that so there are various conferences and seminar which goes around in the weekends. So in hotels and also where you can attend. So these conferences, the accessibility will be easier. So you can get this exposure of latest advancements. What are the latest literature is there? So these conferences keep happening and the workshops keep happening at a very regular intervals. So it becomes easier if you stay in the city to attend. So that is another advantage of considering these corporate hospitals in Hyderabad, sir.
Yeah, but that I observed, man. Not only now, since a decade,
Sir.
somehow a lot of academic programs would be happening in Hyderabad.
Right, sir. Right, sir.
Actually, I have to tell you, it's more than Bangalore. Surely, no doubt in that. They
Sir.
do lot of programs every. As you told, I think monthly two or three would be going on, no? Related to anesthesia, so many would be going on.
Definitely, sir. And then they have this branch. This is suppose ISA Hyderabad or ISCCM Hyderabad. These chapters and all they run, and then they are very much active in running these workshops as well as these conferences. So they do some annual updates. So like that, yes, definitely. If you are able, you are missing out on some of the academics. This tend to cover for it.
Got
So
it.
that is one. So always one discussion comes when we come to DNB as well as MD. And this, I think, I mean, like, our people would also want to know what about the academics. So yes, there has been little bit of when you compare with the MD anesthesia, the where the running is more of towards on the academics and all. So DNB being a corporate hospitals, so where the work exposure is more, but then academics is slightly, compared to MD is slightly less. But then what the NB does to cover for it, they hold weekend classes for all departments. So whatever branch you consider, they hold weekend classes, and these weekend classes are taken up by very reputed faculty as well as good teachers. So they select good teachers, and then the if you consider this, that maybe the academics maybe will take a hit, but then yes, every Saturday, at least in neuro anesthesia, and I have seen some critical care also. So then they, in these cases, so every week 1 hour they will 1 to 2 hours they will give it for the academics. So where from different places, different good hospitals from the central institutes, they come forward with good presentations and good talks. So that usually tends to cover for it. And the thesis is another thing that we would think of. So thesis is one thing that if you are good enough to select a decent topic, so caseload in corporate hospitals will never be a problem. So you can do that, and then they all nowadays all corporate hospitals have their own ethical committees also. So that shouldn't be a problem. So at least in the metropolitan city, this Hyderabad should not be a problem.
Man, one more hospital is Continental Hospital.
Yes, sir. Continental also, I have been to that hospital. It's also a decent hospital.
Okay.
Yes, definitely in terms of consultant levels, they match with all other the centers, good hospitals. So definitely any corporate hospital which has got a decent 200 bedded this thing, then they have good load. And yes, sir.
Yeah. So then we covered most of the hospitals in Hyderabad.
Yes,
Just let me tell you few other ones in Hyderabad.
there is one good hospital in called ESIC, sir.
Yes, I see. Correct. Yeah.
ESIC, I'm not sure if they run DNB programs, but then that hospital is also very good. They also have good faculty, and then the work regime over there is also very much fixed, and then their pay is also very good. So Telangana, I will also say one more thing is that people will ask about what is the stipend they give. So Telangana stipend, at least in South Indian states, it is very good and more than beyond par to compare to the other states. So if it is super specialty when we were doing, so the stipend started with 85,000 up to, by the final year you go, it comes to 1 lakh, which almost matches with the Delhi universities. So Delhi colleges. So that is one thing, and cost of living also is comparatively slightly less compared to the other metropolitan cities. That is another advantage for the Telangana. So stipend is very good. That I think you should consider when you are opting for these hospitals also. So Telangana, obviously, the new rule is that the corporate hospitals needs to match with the what the government hospitals give, and this is set by the government itself. So they will definitely match, the stipend is definitely matched with the government, how much ever they get. So people doing their postgraduate in government medical college, your stipend will also be matched.
Okay. So, man, next is Fernandez Hospital is good for OBG and
Yes,
neonatology and all that, no?
very good hospital for OBG and neonatology. It has been a landmark hospital, and then it has got good name. So one of the as a layman also, if I was when I was thinking about that, the hospitals, they used to say that they go for the normal delivery as much as possible, and especially anesthetists who are looking to do, if there is anesthesia seat there in Fernandez, then you can be sure enough that you will be good in labor epidurals and labor anesthesia.
There is no anesthesia, only fellowship in labor analgesia and obstetric anesthesia is there.
Okay, sir. Okay, so only fellowship is
Yeah,
there.
DNB anesthesia is not there, I think.
Not there.
As per my knowledge, with the research. So then we covered a significant hospitals, small hospitals we are leaving. We are covering the main ones because, we can't cover every small hospital.
Yes, sir.
And I'm not covering the tier two cities, only the tier one, because
Sir.
there are so many other hospitals also. One more thing, one more Indo-American Cancer Institute,
Yes, sir.
Banjara.
Basava Tarakam karke one hospital is there. So it has been there for a long period of time. It's in semi autonomous kind of institute, I believe. And then the onco, yes, it is an onco center. And then onco center, it is very prime.
Yeah,
And many patients come from far off places from Andhra and Telangana for services in that hospital.
yeah.
And it is a very big hospital, sir.
Okay.
So
Here, anesthesia, I mean, regular DNBs are not there. Only palliative medicine, nuclear medicine, radiation oncology.
it will be difficult for me to say, but then one palliative medicine, one thing I would just put one word, sir, that palliative medicine is now coming up very well. I am also doing one neuro palliative care
So,
course myself. So then, yes, if somebody who is very much interested in palliative medicine, and this hospital will definitely provide you good exposure in terms of patients, and wide variety of onco cases come to this hospital, and it is very well reached out to all peripheral centers in both Andhra and Telangana also. So
good.
definitely in that terms, yes, you can consider, sir.
Superb.
Yes.
Then, uh, Medicover Hospitals, Madhapur, Hyderabad, they have anesthesia, DNB, orthopedics, critical care, general medicine, general surgery, everything is there.
Uh,
If you
yeah,
don't, you can prefer not to talk also. Like,
yes, Medicover I never went to, sir, but then
okay,
it
fine.
has
If you
also
don't,
got a good name. It has
yeah.
also got a good name.
Yeah.
So
Even this is a branded hospital only,
it's a
Medicover.
branded hospital, sir. They have got multiple branches in multiple cities, and then they're well funded also. They're very well funded, and then their hospitals also they have got, because they have got chain of hospitals. So yes, that
Most
will,
of the hospitals are click actually. They're in Kakinada.
yes, sir.
They're
Yes,
in even Bangalore. They've come up in Whitefield. One hospital has come up now, and
sir.
they're going to launch in. I think they launched recently. They started the services. They're coming in different parts of India now.
Sure, sir. Yes, sir.
And Nizam Institute of Medical Science. Everyone knows about this
Yes,
NIMS. So it's a pretty famous hospital. Here, even here, there is, but all super specialties are there here. There are so many other hospitals. So all the rainbows of Hyderabad would be good, no, for pediatrics.
definitely, sir. Pediatrics and neonatology, and also they have these pediatric subspecialties, sir, for like the pediatric gastroenterology, pediatric neurosurgery, pediatric hepatology. So they have this rainbow group of hospital. They have these subspecialties, and which make it more and more like you can see rare cases coming into that hospitals. So definitely, in terms of pediatric, rainbow it falls in the top options for any person who is considering DNB.
Superb. So Star Hospitals we already discussed, and then Virinchi is another big hospital because I've seen the hospital looks like a fort only.
Yes, sir. So, and it is in the center of the city, and it lies in proximity to Nizams also.
Yeah.
So, Virinchi is also another good hospital, and then, yeah, so definitely, sir. So,
Oh,
I've seen that hospital. The building is pretty much awesome when you see it from the outside.
yeah, it looks like a fort.
It appeals a lot.
Yeah. So I think that's it from Telangana.
Yes,
And
sir.
thank
So, one final thing I'll just say, sir,
yeah,
from the
please.
Telangana side in
Please,
summary.
please.
So, Apollo AIG, they are JC accredited hospitals,
Hmm.
and you will see state of art facilities in AIG and Apollo, and as well as Yashoda and KIMS also. And if you're considering to go abroad, and if you feel that corporate good experience, good protocols, what we have known for, then you can choose this both. And all the prime hospitals in Telangana, Hyderabad, like KIMS or CARE or Yashoda, Apollo, AIG, they run all multiple specialities and they have got good equipment. So you can always consider. Second is when it comes to academics. So Hyderabad is never short of workshops and conferences. So you can always attend. And then DNB they has this classes every weekend which will help you. And third thing is that Telangana definitely is known for its, right now in the South India. I think the stipend is very high, and cost of living is also will be okay. You can save some money also. So these are in short, I would say about Telangana, sir.
Perfect. See, very nicely you summarized, and it will help a lot of people who want to come to Hyderabad And language, see, some many people wouldn't know Telugu or Telangana. What about that?
So language, this here people they tend to understand Hindi, and most of the people they speak Hindi because uh, though their Hindi is slightly different, but then they understand Hindi very much. So it is not necessary that you have to be a Telugu speaking person only. And the consultants also who come here, they come from various states and various backgrounds. So these are all nationally renowned hospitals where you will find patients from all over the country. So in that manner, you will not find Telugu to be language should not be much of a barrier. In my hospital, only 50% of the people they come from different state who have not known Telugu, and then within 1 year they pick up. So what is necessary for the clinical history and all, so that definitely you will pick up.
That can be learned. Even I talk Kannada now. I stay in Bangalore, so but I've been since long time. But still, I managed to talk a little bit only, whatever is required for me to get information from patients. So then